Hi, and welcome to this informational video on the Oxygen Conserving Device, or also known as OCD. The OCD works by delivering oxygen at the start of each inhalation, only providing what the body needs to effectively use oxygen. This feature extends the life of an oxygen cylinder by reducing wasted oxygen, especially during exhalation. It's particularly useful for mobile patients who require oxygen support throughout their daily activities. Now, let's take a closer look at the features of this specific OCD model, the CHAD Evolution. On and off button. This device has a power button that you'll use to switch the unit on and off. Flow adjustment. There's a triangular control that allows you to adjust the pulse flow setting. This feature is essential for customizing the oxygen delivery to meet the prescribed levels set by your healthcare provider. Pulse and continuous flow mode. This OCD can operate in two modes. The pulse mode is the default, delivering oxygen only when you inhale through your nose. The second option is the continuous flow, which only delivers 2 LPM continuously. Battery and alert system. The device runs on AA batteries and has visual and audible alerts to notify you when the battery needs replacement. It also includes alerts if it doesn't detect breathing for a specific duration. Pressure gauge. The gauge allows you to monitor the oxygen levels in your cylinder. If the needle is in the red zone, it's time to replace your cylinder. Attaching the OCD to an oxygen cylinder. To use the OCD with your oxygen cylinder, follow these steps. Begin by making sure the cylinder is closed and the OCD is off. Place the OCD over the cylinder's valve, ensuring the alignment pins match with the corresponding slots on the cylinder. Tighten the valve adjustment knob to secure the device in place should be hand tight. Attach a nasal cannula to the oxygen outlet. Turn on the oxygen flow by pressing the on button and set it to your prescribed flow rate using the triangular control. Open the oxygen cylinder valve. Place the cannula in the patient's nose and have the patient take a breath through the nose. How to switch from pulse to continuous flow. Switching from pulse to continuous flow on an oxygen conserving device, OCD, typically involves adjusting the settings on the device itself. Turn off the device. Before making any adjustments, always turn off the oxygen device. The OCD should have a control panel with settings for both pulse and continuous flow modes. This is the circular dial on top with the buttons. The dial allows you to switch between pulse and continuous flow settings. Rotate the dial to the right, clockwise. For the continuous flow setting, you will see the arrow pointed to CF. Once on continuous flow, the device will deliver 2 LPM. Make sure you have the cylinder valve to open. Tip: the on and off button and the triangle button is for the pulse setting only. When the continuous flow setting is being used, ensure there are no lights displayed on the screen. Just ensure the cylinder valve is open. If you're unsure about the process or the device behaves differently, refer to your device's specific manual or contact your oxygen provider for assistance. Common troubleshooting steps. If you encounter issues with the device, here are some quick troubleshooting tips. Device not turning on. Ensure that the batteries are correctly inserted. If the device still doesn't power on, replace the batteries with fresh alkaline ones. Short battery life. Avoid using rechargeable batteries, as they may not provide the necessary power. Only use recommended alkaline batteries. Oxygen leakage. Check if the Bodoc seal is intact and properly positioned. If the unit isn't securely attached to the cylinder, close the valve, remove the device, and reattach it. The Bodoc seal is missing or damaged. Remove the OCD from the cylinders and check to see if the Bodoc seal is still in place and in good condition. If the Bodoc seal is missing, please check your surrounding areas, for example the floor and your carry bag, and also check your old oxygen cylinder. When swapping over your OCD, the Bodox seal may have stuck to the old cylinder you were previously using. If you locate the Bodox seal, place it back in place on the OCD. Please note, if you are touching the Bodox seal, make sure your hands are clean to avoid contamination. Low oxygen flow or no flow. Ensure there are no kinks in the cannula tubing, and that the cylinder valve is fully open. Periodic alarm. This may occur if you are breathing through your mouth and the OCD device is not registering your breath. Close your mouth and take a deep breath through your nose to activate the pulse delivery system. Following these steps should help you get the best performance from your OCD and ensure a smooth oxygen therapy experience. Thank you for watching this guide on the OCD. For any additional questions or concerns, please contact your healthcare provider or Air Liquide Healthcare Support on 1300360202. Alternatively, in the case of a medical emergency, please contact 000.